Hi, I'm Tom Burke, and welcome to Public Health on the Inside, your inside look into the world of public health. I'm the Associate Dean for Public Health Practice here at the Johns Hopkins Bloomberg School of Public Health, and through our series of podcasts, I want to take you to the front lines and introduce you to the world of public health practice. The world of public health practice is filled with amazing opportunities and very difficult challenges, and that's what we'll explore on Public Health on the Inside. So today, I want to introduce you to a friend and colleague and our Chief Public Health Officer, Dr. Josh Sharfstein, who is the Secretary of the Maryland Department of Health and Mental Hygiene. And Josh, you really have a unique perspective and lens on public health practice because you have served on Capitol Hill. You've served as Baltimore's Commissioner of Health. You've served as the Chief Deputy and Acting Commissioner of the Food and Drug Administration. And I think you're the only person I know who's been appointed by a governor, a mayor, and the President of the United States. What a lens. Thanks for being here today, and welcome to Public Health on the Inside.
Thanks for having me, Tom.
So, Josh, I have to ask you to reflect a little bit for our listeners on your experience at the different levels. When I begin the school year, I ask my students to fill out an index card with a little bit of background information, and I ask them for their dream job. You've actually had 4 of the most popular dream jobs, so I hope you can share your perspectives on that because many of our students aspire to the kind of leadership role that you now have. So tell us about that and a little bit on the differences and the ride.
Well, it's a real privilege to wake up in the morning and your focus is on how you can move health forward. And when I was the health commissioner for the city of Baltimore, it's how can I make my city healthier? And now that I'm the Secretary of Health in Maryland, it's what are we going to do today to really move health forward in Maryland? And there are different kinds of challenges. There's nothing quite like being at the city level where you've got everything from ostriches running around downtown Baltimore, nobody knows how they got there, to we have a problem that Medicare Part D is going to take effect and there are going to be a lot of people who may not be able to get their medicines this week. What can we do about it? So you got to deliver. Everyone's expecting you to. You've got a strong relationship with the mayor and the city council, and it's just a lot of urgent challenges. The federal level is a little bit removed from that, although FDA is a hands-on regulator to about a fifth of the economy by some measures, and there are a lot of things that the agency does that are urgent, like food safety challenges, but there's also a longer-term agenda there where you're thinking about what is the right way to balance benefit and risk for pharmaceuticals, for medical devices, and a whole bunch of other challenges related to the way the market works. The state is an interesting combination of those two perspectives, but what I get uniquely in this job is healthcare finance because our health department oversees the Medicaid program, which is $7 billion, and we're really point for implementing large parts of healthcare reform. And this is just a really exciting time right now. I think that this is an opportunity for us to align the healthcare system for health, and that's a public health job. How do we do that? How do we both take care of individuals and improve the health of the population?
I think that's important. A lot of people see the healthcare system as kind of separate from public health, but we in the field know that's all one. And this is an incredible opportunity for us to work toward prevention and changing health, not just health care.
Certainly, and I think one of the really interesting things is we're seeing some incentives change in the healthcare system. It used to be a lot of the payment in health care was just on volume. So someone gets admitted, hospital gets paid. Someone goes home, comes right back, hospital gets paid again, and they just keep getting admitted and the hospital keeps getting paid. Well, some of those payment systems are changing, so the hospital gets penalized if the patient keeps coming back. And the hospital starts to think, well, how do I keep the patient from coming back? What are the tools that I have? What are the tools the community has? How do we keep patients healthy? And that's a public health conversation. So it's a really exciting time to be at that border between healthcare finance and public health.
But Josh, it's also a very difficult time for the states, particularly with the federal budget issues. It's a time where we really have to look at expenses and are limited in the resources that we have. How is it to manage such a large organization during these very tough fiscal times?
I think that the big picture here is that costs have to be controlled, not just for a Medicaid program, but for healthcare in general. Employers are asking themselves how they can pay for healthcare, just like I'm asking myself when I see the budget how we can pay for healthcare. And there are two ways to control healthcare costs. One is in ways that help patients, and one is in ways that don't help patients, that actually hurt patients. And you see some states that are moving in the direction of tossing people off of health insurance, working families, working parents, and that's maybe, I think, a little bit of a penny wise and pound foolish approach. We're really trying to figure out ways to put the right incentives in place where you can cut costs and you can improve health at the same time. And people talk about the triple aim as a goal. It's where you improve the patient's experience, better outcomes, and lower costs. And there are examples of that around Maryland. One of the things that I've done working with the governor and lieutenant governor in the state, who are enormously supportive of healthcare, is to set up a work group that will be spotlighting these innovations where we have better outcomes and lower costs and better patient experiences at the same time, like a successful program that reduces heart failure admissions. The patients are better off because nobody wants to be struggling to breathe and admitted to the hospital, but you also save the hospital costs and they're better community health outcomes. So how do you pull that together? How does Maryland do that as much as possible so we're lowering costs the right way and not the wrong way?
Josh, you mentioned innovation, and you're a very creative guy and innovative in a lot of ways. And one of my fondest memories of you, and I should mention you're also a member of our faculty here, and you are a commencement speaker at the last commencement. And one of my fond memories is after you gave your talk, we were sitting next together there right in front of 2,000 people, and you said, "Do you think it's okay if I tweet my speech?" And you took out your BlackBerry, and through Twitter, you made your information available to people who are following you. And you've used the social media. You've been a great communicator. Tell me about how we might think about new ways to communicate in public health and how you use that.
Sure, that was the speech where I encouraged the graduates to go out and really have a wild night of moderate physical activity and healthy snacks.
An outstanding speech.
I think that there's a lot of potential with new media, social media, different tools, and I think public health is just scratching the surface. I think there's enormous potential for new people coming into the field to really blow it open, do some really creative things. One of the things that we're looking to do, instead of when we give out money for particular ideas, have this sort of usual send in an application, we look at it, and we tell you whether you're getting money. It may be for certain things. We're going to do that in an open way on the internet, let people see the different proposals, vote on them, ask questions, and then use the wisdom that you can gather from that kind of process to develop a plan to move forward and also encourage people to come together around other ideas. I think text messaging is probably way underutilized as a public health tool, and I've seen some really interesting data on how populations that we're really trying to reach really do use text messaging and how it can really be helpful. I've seen some data that when they had a text program that if you text in your location or you send a text somewhere, they tell you where the nearest HIV test is, that gets used most at 3 in the morning.
Mm-hmm.
Now, there are not that many public health departments that are going to have someone sitting by a phone at 3 in the morning. But if you had a system like that, you may be able to get information to people when they really want it. So I really think we're just at the beginning. My woefully small number of Twitter followers at Dr.
I
Josh
am one.
S., I will say. Okay.
Yes, give us the address.
At DRJOSHS. That number may be small, but I think our goal more broadly is to figure out how to use new media and really not just in a one-way, this is how we communicate, but how we gather ideas. We put out some thoughts about how to measure the health of Maryland, and we asked for public comment. We got more than 250 public comments on that. When in Maryland, typically, they haven't been doing public comment periods on things, but there's just a huge interest and engagement. And one of the goals of any public health leader has got to be to excite people about public health and health in general, and I think all these tools are ways for us to do that better.
And Josh, you are finding ways to do that, and I know that many of our students who grew up with Facebook and grew up with social media are really interested in using this in innovative ways to advance public health. There's a huge need out there. I'd like to ask you about something that maybe is a little bit more difficult to talk about, that, and in that public health leaders sometimes have to roll up their sleeves and take on a controversy. And you have not been afraid to be active on the Hill and to challenge industry and big pharma to really do the right thing. And I'd like to ask you about that because it's something that we're called upon to do as officials, but it's not for the faint of heart.
Well, I think that when you identify something that's important for public health and you really line your ducks up, then you take that where it leads. And I have to be honest with you, sometimes I have been pharmaceutical companies' champions, not on purpose, not with a specific relationship with them, but I was a very outspoken advocate for buprenorphine treatment in the city as a way to address heroin addiction. And there's a great company that makes that treatment, and they were, I think, pretty happy with me that I created a big program in the city, and we successfully, significantly reduced heroin overdoses, and that was part of a strategy. I've also been pretty outspoken about vaccination, even in the face of people raising some different kinds of criticisms about vaccination, some of them with justification, some of them maybe not. But yes, I have not been shy about that. When I was City Health Commissioner, we worked with the pediatric community in Baltimore to recognize that over-the-counter cough and cold medicine for young kids really did not offer a benefit and potentially posed a serious risk. We'd had some deaths of kids from overdoses, and you have to ask yourself, does the benefit exceed the risks? And we really didn't think there was much of a benefit. All of the chiefs of pediatrics in the city signed a statement. We turned that into a petition to the Food and Drug Administration, and the industry voluntarily withdrew those medicines from the market, first for kids under age 2. You can't get those anymore, and then for kids under age 4. I was pretty gratified to see a recent outcome study of poison control calls that showed a 50% reduction since that happened in these products. So I think you got to call them like you see them, and sometimes you wind up on someone's side and sometimes you don't. But if you have a good process and you're based in evidence, it can be worthwhile either way.
So this must give you a great deal of satisfaction when you see those kinds of data coming from the poison control centers. In closing, Josh, I want to ask you a question for our students. Many of them aspire to the kind of leadership positions that you've held and you currently hold. What kind of advice do you have for students who would like to be a leader in the public health?
I think that it helps to really decide what you want to see accomplished and find positions where you can work to make progress in the right direction, and not be so worried about the name of the position, the title of the position initially, to really focus on doing good work, doing things creatively, measuring your success as you go through, learning from things that don't go well, and everybody has things that don't go well, and letting opportunities kind of come to you, keeping an eye out for them, but not being so worried about a straight career trajectory. I think that there are just so many ways to have an impact. It could be the kinds of jobs that I've had. There are great public health jobs inside hospital systems. There are great jobs inside payers. There are great jobs in all sorts of different agencies. And, what is it that really drives you? What gets you up in the morning with a skip in your step? And to really be focused on projects that make a difference and how you can move them forward, and hopefully things will fall into place.
Secretary Sharfstein, thank you so much for sharing your time with us, and thank you for all you do for the people of Maryland and that you have done for the nation. I think you're a real trailblazer in the way that you have approached public health, advanced communication, and put your creativity to work for public health on the inside. Thanks for being here. And all of you listening, thanks. I'll see you again soon.